Ministers, thank you very much. It's been really interesting to hear the debates this evening in various areas. Tonight I want to talk to you about Fidel. Fidel is a lady from my own little town of Bailborough. She has many challenges in life, but was recently diagnosed with a strangulated hernia, scheduled for an operation in Beaumont Hospital. Naturally, over the last 2 years, COVID testing has become a natural part of, I suppose, hospital life and preps for operations and things like that, which we all understand. Sadly, PCR tests were not acceptable from the local testing centre. Long story short, Minister, her test was, her operation rather, was cancelled on 3 occasions, and I know you may have had an opportunity to look into this in the next statement.
Minister? Mr. Donnelly, you taking this? You are?
Yes, I am. Thank you. Thank you very much. And can I thank you for raising the issue. And look, I can't discuss an individual case obviously here, but the situation doesn't sound satisfactory for your constituent at all, and something does need to be done about that. The broad question, if I am correct, Deputy, is around the general delays in Beaumont Hospital, and that's okay. And I want to really acknowledge this huge inconvenience and distress for patients and for their families, in spite of an incredible team at Beaumont who are really doing everything that they can. They have made every effort to avoid cancellation and postponement, but Beaumont has been impacted, obviously, by the operational challenges that COVID brings. Now, Beaumont has taken actions, including a period of prioritising unscheduled care, COVID care and urgent time-sensitive work. Now, my department's working with the HSC and the NTPF to find ways to improve access to care in Beaumont. It includes the use of private hospitals, weekend work, evening work in Beaumont, various see and treat services, virtual clinics, and various other initiatives like that. Now, at Beaumont, general surgery, which is probably what the most relevant point here, makes up a significant portion of the inpatient and the day case waiting lists. The NTPF has advised that it has approved 4 inpatient and day case initiatives for funding so far this year for Beaumont Hospital, including for general surgery, which should help. The NTPF has also approved 16 outpatient initiatives, again, this year. And together, these initiatives will facilitate treatment for about 9,000 patients on the waiting lists in Beaumont. And I would certainly hope that the lady Adele that you've spoken of, either through that or through the issue around the testing, that she gets the care that she clearly urgently needs.
Thank you very much, Minister. Deputy Smith.
Thank you, Minister, and thanks for your foresight in seeing where I was trying to get with the question. But it is about the issue of deferrals and delays, and I can thank you that give you the good news that Fidel has actually got an appointment now. But just to make the point, she had, 3 disappointments, 3 occasions of having to isolate from her family, 3 cancellations. It's very distressing for people. But she's come out the other side of it now, and she's getting that. On the same issue, I just want to talk to you a little bit about Dara. He's 10 years of age. He's from County Monaghan. He's a child, was born with no arms and missing his femur bone in both of his legs, and is a wheelchair user. And yesterday I had listened to his mother tell a very heartbreaking story of his problems and delays and deferrals too, waiting for a hospital appointment for surgery, actually, orthopaedic surgery in Temple Street Hospital, cancelled on 4 occasions. And the story that she told of the excruciating pain, the deep distress, and the continuous pain that this child is in waiting for this surgery. And I know our hospitals are under pressure, but again it comes back to this thing of deferrals and delays. They're really not acceptable.
Thank you very much, Deputy. Yeah, and I heard that testimony, and it is so difficult to hear. It is just heartbreaking for Dara and for his family. He needs access, and children all over the country need access to really specialised orthopaedic surgeons and treatment in Temple Street, in Crumlin, and in Kappa, and aided by some of the other hospitals. We're putting in place a really ambitious plan. We're funding operating theatres, we're funding staff, we're funding diagnostics, and we're going to be funding a lot of things to make sure that Dara and other children who are waiting and who are having their planned operations cancelled again and again, which is so difficult for the children and so difficult for the parents that it becomes, first of all, that the time they wait goes down, and that the amount of times where these things might be cancelled really is minimised.
Deputy Smith.
I have to say, I have listened to you tonight, and I know you're very strong on this whole issue for orthopaedic surgery and for children. And I want to just say I am heartened to hear what you've had to say tonight. I hope his mum, Shelley, will get some relief from that. As I said, they have had 4 disappointments, and for a child with that amount of complications, that complexity around his issues, you know, time is important. And I know they had to travel to Dublin for pain relief to keep him going for another 2 weeks. So listen, Minister, all that you're doing on deferrals and delays, ensuring these children get their operations and that they're not disappointed and their families are not disappointed, is very much welcome. And just to say thank you for all your work on this issue.
Thank you very much, Deputy. And look, we owe it to these children, we owe it to their parents. I met with all of the 3 hospitals last week on the Monday. I then went out to Kappa on Friday. Further meetings today. This is a top priority. We're going to be funding this. We're going to be prioritising this. We're going to be getting these children the care they need, and giving the supports to our incredible clinical teams to do the job that they know how to do and want to do. Thank you.